Well, good afternoon, everyone. First of all, it's really wonderful to be here and to have such a important event to celebrate. The 5th year anniversary of the council is really something worth reflecting on, as people have done already, and thinking about the remarkable achievements. And so I say that as a public health commissioner, and I'll talk in a minute about some of the ways that we've worked in partnership with the council and its members, but I also want to say it as a consumer. And so I'll tell you 2 stories that relate to why I personally value the work of the council. The first one involves my father, who 20 years ago had surgery for a gallbladder, kind of relatively minor surgery, and then was in a coma for 6 weeks because it was found out later a sponge had been left inside after the operation. And, I remember at the time, 20 years ago, sort of we found that out, and he slowly recovered, but we actually didn't think you could do anything. We just thought you could, hope you weren't going to get unlucky the next time, or maybe your goal was just stay out of the hospital no matter what, because you couldn't count on anything. And really, 20 years ago, there wasn't an advocacy movement around healthcare quality and safety, and you didn't know, as a family member, we didn't think we had anywhere to turn. So I would say since being health commissioner in the state in particular, and since working with and seeing the work of the council and knowing people like Lucilia, I try to channel that energy and knowledge through information on the certification website, for example. So now my mother, I have a mother who's 99 years old, and she really, her goal in life is to be left alone. She doesn't care what happens to her. She does not want to go to a hospital or be seen by a doctor. But of course, she lives in assisted living, so every 6 months, something happens. She falls down, or she brushes against something and cuts herself, and so the ambulance gets called against her wishes, and she gets carted off to the emergency department. And every time I'm involved in channeling the council in terms of arguing with the emergency department. No, we do not want that invasive procedure. No, we do not want those unnecessary tests. No, just put a Band-Aid on it, put her back in the ambulance, send her back to her bed. But it's I'm the health commissioner, right? And I get nowhere in terms of this by saying, I've tried saying things like, but I'm in public health, I actually know something about this. Nothing, right? Nothing. The only thing that gets me anywhere is to be an assertive patient advocate. So I can, I basically, know what her rights are, or what my rights are. I always say I want to speak to the ombudsman, or who can I speak to in the hospital? I don't want to speak to the resident who's caring for the person who's trying their best. I want to speak to somebody who will just stop the care right now if it's inappropriate. And so I would say on a personal level, thank you also to the council, because I think I'm not alone. I think there are people all across the Commonwealth who have learned from and been inspired by your work, so that within their own families and their own, friends, and they're able to speak up and advocate. And I think also because you've created an environment in Massachusetts where people know that there is an active advocacy and patient rights and family rights community. There's greater awareness. It is not. I don't think it's adversarial. I just think that it's been like a consciousness-raising process for the hospitals and nursing homes and health centers to really learn. This is good. It's good to promote the highest level quality of care, and this is helpful. This is essentially the right thing to do. So, thank you for that. And when I take off my individual consumer patient advocate hat, I would speak on behalf of the Department of Public Health to say, thank you to the council. The council existed before I was the commissioner, so I was very lucky. I came in, 4 years ago, and right away heard about the council work. And I think in my first few months I came to a meeting and saw the work that was going on and heard about it. a terrific partnership for us, and that we've really seen in the ways that policy can change and legislation can change. Thank you very much, Representative, for your leadership and making sure that things actually have to happen, because the legislature provides leadership and you provide leadership. I've had the great pleasure of working alongside of Lucilia Prates-Ramos, who has been an inspiration in terms of her work on the Public Health Council. The Public Health Council sets policy in Massachusetts. And by the way, I believe that the reason that Lucilia is on the Public Health Council is in part because the council existed, the health quality, the Consumer Health Quality Council, that is, because when the Public Health Council rules were rewritten and the old council rules with like 8 members were thrown out, you know, specific criteria, and the new council was created, there was a consumer advocacy position that was specifically designated, with health care for all being the organization that would identify that person. That's the seat that Lucilia holds, and she has ensured that as we look across the board in terms of, you know, anything, any policy issue, you know, we have a remarkable leader and outspoken person in Lucilia. So thank you for Lucilia for your work. And I've benefited from hearing Lucilia courageously tell her story about her father, and that I think has moved many people in the legislature as well as in the state government and around the state. And I know that other members of the council have done the same thing. Thank you for your help in terms of the passage of the legislation, the implementation of the legislation. You know, the representative mentioned this, but it's the hospital-associated infection regulations that came from the legislation. It's the serious reportable events now legislation. That also means that greater attention is being paid to things like falls in the hospitals or ulcers in the hospitals from lying in bed too long. So this is really making a difference in terms of saving people's lives and preventing unnecessary injuries and conditions. Other ways that we've worked closely together and appreciated the council is through the work of the Betsy Lehman Center, and Tracy Gay is here, who's provided leadership there. And the council really helped to ensure there too that it was helping to inform the focus of the Betsy Lehman Center on things like studying these issues. How much does it cost the Commonwealth, for example, when hospital-associated infections occur? The answer there is $400 million a year. So it becomes clear, if we want to focus on reducing healthcare costs, why don't we focus on an area where reducing the costs will also improve healthcare quality? That's a great place to start, and I think that real progress has been made in that regard. And then we've just, I think, again, with your leadership, look for other places where we can make improvements, providing greater information to patients and their families in nursing homes, for example. There was a legislatively mandated brochure, which we've just done and made a big difference already, I think, in terms of nursing home operations. And making sure that our inspectors, the nurses and others that go into the hospitals and nursing homes really are informed, are consumer informed, and not just government regulators, but they really try to now, we're increasingly trying to train people to go into those facilities with the lens of what is the experience like for the patient, and that's new. So all that is why I'm saying thank you. 5 years of just outstanding work and dedicated hard work by council members. And so it's my pleasure to not only be able to thank you, but also to present certificates of recognition to the members of the council who have advanced this work by telling their own story, by willing to come to policy meetings, by working closely with the legislature, and by helping us at the Department of Public Health